community has long been hard to reach for the ideal health services. HIV care is no exception. And as Dr. Mercy Korir, our medical correspondent, reports, prevention of mother-to-child transmission of the virus has been taken a notch higher by making diagnosis easier and faster.
The 4% prevalence rate of HIV in Turkana County could be accounted for by the fact that one, Turkana is on a transit zone. It neighbors Uganda to the west, South Sudan to the northwest, and Ethiopia to the north. Additionally, many NGOs and other organizations have development projects in the county. This means that many of the people working for these NGOs are not originally from the Turkana community. As a result, many women are at risk of contracting the virus, this putting their unborn children directly at risk of mother-to-child transmission of HIV. Let's call her Aspita, though that is not her real name. At 24 years old, she's a mother of 2. This is her youngest child. It was during this last pregnancy that she was diagnosed HIV positive.
Alikuwa na wasiwasi wakati alikuwa mjamzito, alikuwa anafikiria mtoto wake anaweza muambukiza. That's why alikuwa na wasiwasi kabisa wakati alipatikana kwa positive.
Living a few kilometers from Aspita's home is yet another young mother. We will call her Akiru, and that also is not her real name. She is 19 and was also diagnosed while pregnant with her second child. She had a lengthy chat with her husband who works out of town.
Naambia sio peke yako ndo wa kwanza. Labda kuna mahali tulipitia ama alipitia lakini hakujua. Safanya hivi tunataka tufanye huyu mtoto awe na malezi bora.
For many of the mothers with HIV-exposed infants, that is the main worry, the future of their babies.
If the virus is not detected early, within the first 1 year, 30% of them will have died. If at all we delay care and treatment within the next 2 years, 50% of all those HIV-exposed infants will die.
Early infant diagnosis of HIV means that mothers can be at ease knowing the status of their children.
Napeleka result Eldoret, ndio baada ya mwezi 2 ama 1 ndio kuja upate result. Hayo mwezi 6 sasa nikarudi, wakachukua mtoto dawa. Nilikuwa na hamu sana kujua hali ya mtoto.
HIV-exposed children are supposed to be tested at 6 weeks, 6 months, 1 year, and 18 months of age to determine their status.
For a long time, we were using the antibody antigen test, which when a child is born, he carries the maternal antibodies for 18 months. Mothers who are HIV positive and who bring forth HIV-exposed infants previously had to wait for 18 months for them to know whether this child truly has HIV or not.
Tulikuwa tunahangaika kabisa. Yaani tunastuka tunasema result imeenda huko. Itarudi lini sasa tuangalie tena result. Maybe sasa mtoto na ameambukiza ama nini.
Nilikuwa na wasiwasi, nasema nitampata mtoto wangu ako naye ama kuna, yani nimeongoja nikakuja kila siku na uliza daktari ije kuja bado.
Infants are very sensitive and need to be put on treatment immediately, especially if they are HIV positive, because we know that even at the time they require the 6 to 8 weeks test, 10 to 15% of the infants will have died.
It is in this regard that this point-of-care diagnostic machine was installed in Lodwar County Referral Hospital. Mothers are informed of their child's HIV status within an hour.
When we used to send our samples to AMBAT, we used to analyze within a month. We only had to send less than 20 samples, and getting results was taking 3 months. But since we installed this POC in our facility, so the numbers now they are spanning up to 48 per month. All the clients, that is 100%, all the clients are getting their results within 1 day.
This is significant progress.
Yani ya leo inatimika kabisa, yani inatupa motisha. Ya hata tukieni tena tunatamani tena tupate mtoto mmoja tutupime haraka zaidi tuendelee.
Matokeo ya mtoto yamerudi, na kama vile tuliongea hapo mbeleni, mtoto akichukuliwa damu tunatarajia matokeo mara 2. It's either iwe positive ama negative.